I want to welcome everyone here this morning and tell you how much I appreciate everybody being here for our LSU Health Science Center Shreveport public briefing on COVID-19, specifically related to research and clinical trials and an update on the testing that we've done so far and what direction we're going in. I want to sort of remind the media that the Health Science Center here has been on the forefront of offering clinical trials that very few cities have access to, particularly cities the size of Shreveport-Bossier. So we're really very, very proud of that. I want to thank the media again for their excellent coverage of this COVID-19 pandemic at large, and specifically for the ways that you're addressing it in our community. And there's really four areas that we want to focus on this morning. One is on our Emerging Viral Threat Lab, part of our Emerging Viral Threat Center, and its impact relative to testing, both directly for the virus and some serology testing that's going to be coming up that I'm going to leave for Dr. Kevel and our other colleagues to discuss. In addition to that, we're going to give you an update on the inhaled nitric oxide clinical trial, as well as an update on the convalescent plasma therapy, which is a program that we have put in place in coordination with LifeShare Blood Centers. So I just want to remind everyone, as the number of cases in Louisiana continues to go up worldwide, we have about 2 million confirmed cases, 130,000 deaths worldwide, and in the U.S., 610,000 confirmed cases and over 26,000 deaths. Louisiana still had one of the highest spikes that it's had in a while, with 129 deaths reported yesterday. We understand that's not all reported within that 24-hour period, but that's the way it's reported through the Department of Health. Louisiana is still very high and number 3 in total cases and number 3 in deaths per capita. So it continues to be an issue, not just for Louisiana, but for the entire country. And so without further ado, Dr. Connie Arnold will come up and give everyone an update on testing. Thank you.
Thank you, Dr. Ghali. So Dr. Ghali and Dr. Kevel had asked Terry Davis and I to reach out to federally qualified health centers in the rural areas that we work with, that do research with us, to see about their testing needs. And in addition, we Partners in Wellness, who currently serves 23 parishes in rural areas for cancer screening, with Doctors Jerry McLarty, Jennifer Singh, and Jenny Green, also reached out to our partners to see what the need for testing was. Commissioner Jackson also reached out to Dr. Ghali to see about testing in underserved areas in Shreveport and the rural areas in Caddo. And so I'm going to give you an update on where we are repurposing the Partners in Wellness van to be able to do testing for patients who meet the CDC guidelines. Right now, we're scheduled to test tomorrow at Community Health Services. It's a federally qualified health center in Marion, which is in Union Parish, from 10 to 2, in Bastrop, in Morehouse Parish, from 1:30 to 4. Then a week from Saturday and the following Saturday, we are testing in the MLK area from 10 to 2 at the David Raines Clinic, who is partnering with us by volunteering the space to put the van, and they are also providing the call-in number, which should be available by Friday. This is a reminder that people still have to meet the CDC guidelines to be tested, so we want to pre-screen patients before they come up. We are also setting up screening dates for Cedar Grove neighborhood, the Moortown neighborhood, Gillum in North Caddo Parish, Haynesville in Claiborne Parish, and Minden in Webster Parish. We are also reaching out to the northeast parishes later today to see what their need is. And in addition, we have spoken with clinics in Bienville, Catahoula, Concordia, Franklin, Grant, Lincoln, Tensas, and Wynn parishes to also help them with their needs. Thank you.
I hope you guys can hear us okay. I know that there's a little bit of noise in the background, so I'm going to move this microphone up a little bit closer. And I'm going to also ask our speakers to speak a little bit louder. And I'm sure Dr. Woolard won't have that problem. So he's going to come up next. Thank you, sir.
Thank you, Dr. Ghali. Hopefully everyone can hear me. So I'm Matthew Woolard, Associate Professor in Microbiology and Immunology. And I've been put in charge with setting up and running the serology lab. So the serology and the idea of antibodies have been in the news quite a bit of late because it's the next set of tests that you really want to run in understanding what's going on with this infection. So the EVT did a phenomenal job in identifying individuals who have had or have the virus. And so we've gone looking for the virus first. What serology lets us do is ask questions about the immune system and ask, has your immune system seen the virus? And so this is going to be really important in understanding this for one of our first rounds of exciting therapies that is coming out, which is the convalescent plasma therapy. So the serology lab, in collaboration with LifeShare, will be looking at individuals who donate plasma and looking at their plasma to see if they have antibodies against the virus, SARS-CoV-2. Because those antibodies are really important in neutralizing the virus and helping these individuals who are severely sick with this disease to better fight the virus off and allow them to recover. So at this time, we have set up a traditional ELISA-based serology lab, which has the advantages of being much more specific than some of the tests that have been pushed on the market so far, which are called lateral flow assays. The other advantage that we get is we get what's called a titer, which actually tells us how much of the antibody you have. So this becomes important because individuals can have a little bit of the antibody or individuals can have a lot of the antibody. And we really want to use the plasma that has a lot of the antibody because it's most likely to be protective. And so this has been an extremely vast team effort, starting with the leadership here at LSU, with Dr. Ghali and Dr. Kevel, as well as the leaders of the EVT program, Dr. Sapp and Dr. Urachko. And then at the serology lab with Dr. Camille, helping us supply a lot of the reagents necessary to get this up and running, me getting the assay going, as well as colleagues in the lab who have been phenomenal working around the clock, validating this assay, which we're at the point of to be able to begin using to aid LifeShare in testing of the convalescent plasma therapy. And then the next step of this, what we'll be able to do is help us to understand what the real scope of this infection in the community is, because unlike the virus, which thankfully most of us clear and get rid of, the antibodies last a really long time, and so we'll be able to really track who has seen this virus and get a much better understanding going on. And this is the type of data that we need to make really intelligent decisions moving forward on how to best address this infection.
Thank you, Matthew. I think it's important for all the viewers and everyone to understand the most important thing with the test is how valid it is. And the Food and Drug Administration sort of relaxed some of their restrictions on testing when it comes to the antibody testing that's been put out by some of the commercial organizations and various companies. So really, our guys here are very, very serious about validating all the tests to make sure that they definitely work. The real issue with the testing, as Matthew was talking about, has to do with the potential for false positives. So that individuals, there's a very real possibility that the COVID-19 virus could be confused with another coronavirus that potentially would just cause the common cold. And so that's why our researchers here are very honed in at making sure that the sensitivity and the specificity of the test are very, very, very high. The worst thing would be to have a false positive, have the false sense that you are protected And we don't even know really how protected we are with immunity at this point. That's another big question, is how much does it protect it. But from a social standpoint, immunity is important because we want to be able to get folks back out into the workplace. And then also from a personal standpoint, it's very important as well, because you want to be able to know that you can sit next to grandma or grandpa or someone and they not infect you, or more importantly, you not infect them, as sometimes is the case. So I want to thank the group for all the hard work that they've been doing. I also want to introduce Dr. Martha White, who is our Region 7 Director for the Office of Public Health, who is going to talk a little bit about whatever she wants to talk about, but also the importance of convalescent plasma donations here in North Louisiana. Thank you.
Hello, I'm Dr. White. I just really wanted to come and say thank you really to LSU HSC. You know, everyone knows now that my husband has been critically ill, and the reason why my husband is still here with us is because of the hard work of all the people in this institution. I'm very aware of that fact. I'm very aware of the fact that he has received cutting edge treatments, and that's why he is currently stable. He's critical but stable, and I'm so grateful for all the people that are caring for him, from Dr. Scott to Dr. Ghali to Dr. Kevel to Dr. Conrad, Dr. Greer. I mean, I can't even name them all. There's so many people that have done so many amazing things to help stabilize him, as well as everyone in that unit. The unit is full of people who are critical and in need of these treatments and therapies, and are waiting for the right answer. We're learning more about this virus every day, and it's people who are doing this research and trying these cutting edge therapies that are going to help us find the solution to getting more people home. You know, it's heartening to see those videos when you see people who are released from the ICU, but it's hard for me because it's one person at a time, and I want to see lots of people leaving the ICU, so where it's not quite as a big accomplishment as it is right now to get people home. I know that the convalescent serum was beneficial to my husband. I know that it stabilized him at a time when he was on a downward trajectory. And I'm thankful so much to David Langston and the other people who have donated. It's so important. It's something that if you have survived this virus and you are on the other side of it, you should be grateful and thankful and counting your blessings. There are a lot of people who are battling right now to try to get to the other side. So if you can make a donation of your plasma, it's just like giving blood, takes a little bit longer. Please let me know. You can email me at martha.white, WHYTE, @la.gov. And I will get you connected with the blood center, and we will get your donation done, and you will be doing something amazing to help other people and their families, because as a wife, my children, we're all suffering waiting for my husband to come home. So please do what you can. And again, I want to say thank you, all the people in this room, as well as the people in the ICU, the nurses, respiratory therapy, nutritionists. I mean, the list is so long, but we are very lucky and blessed to have this institution here. Thank you.
Thank you, Dr. White, and we will continue to pray for the other Dr. White as well as he continues to recover and convalesce from this terrible disease process. One of our leading clinical researchers, Dr. Keith Scott, will be our next speaker. Dr. Scott is professor of critical care and is one of the lead investigators on the inhaled nitric oxide therapy. Dr. Scott, come on up here. And just to mention again, this is a collaborative effort between Harvard University, University of Alabama, Birmingham, and our LSU Health Science Center. And I believe we were the second site in the country to administer this treatment for critically ill COVID-19 patients. Dr. Scott.
Thank you, Dr. Ghali. This is a trial that, again, we partnered with the Harvard group. We're now partnered with University of Alabama, Birmingham, and the Karolinska Institute in Sweden. And the purpose of this trial is that during the first COVID, the COVID-1, this gas was administered to help oxygen. And they also found that there may be some antiviral effects of this gas. And so with collaborating with the group, that's really what we're studying is, will this help mitigate this virus and help kill it at its point where it's doing the most damage? Because what's really the COVID-19 disease is, it's mainly a pulmonary disease. It's also a hemodynamic disease, but it's really causes tremendous inflammation of the lung and to the point where you can't oxygenate. And so the advantage of this gas is not only will it help kill the virus in the lung itself, but a side effect is it helps improve oxygenation by improving blood flow to better parts of the lung and try to drive it away from the more diseased parts of the lung so that we can get more oxygen in. And we have 2 people enrolled right now. We screen pretty much everyone for this. We have, of course, certain criteria, and we have 3 machines that can deliver this gas at the levels that we need to. We also have a trial, a different trial, but it's pretty much the same thing, as for people that aren't quite as sick and say they just have a fast respiratory rate or maybe mild pneumonia but don't require a ventilator. And in that, we give them 2 30-minute treatments a day, about 12 hours apart, and with the hope that it will help, again, mitigate this disease, keep it from advancing to the point where they will need ventilation. And that arm of that trial will start in the next day or 2, as soon as we get a couple of just logistical things worked out. So this are the 2 trials we have. We're extremely excited about it. The biology makes sense to us, and usually if that makes sense, then there's probably a signal here, and we're very, very happy that we have it here at LSU.
I know we have some questions that are being submitted, and we're going to answer those as soon, right after Dr. Kevel comes up. Dr. Chris Kevel, Dean of the School of Graduate Studies and Vice Chancellor for Research, has sort of been the spearhead of all this, and I can hardly recognize him without his arm cast, but come on up here, Chris.
Well, thank you, Dr. Ghali, and thank you to all of you in the media who have been not only so supportive, but more importantly, so instrumental in communicating the important aspects of these disease states that we face. And as Dr. Ghali said, communication of accurate and proper information is vital for all of us to be able to do our best to thwart the virus. I'd definitely like to extend my thanks to Dr. Scott, Dr. White, Dr. Woolard, and many other individuals whom perhaps you've seen before in earlier press conferences. One of the things I want to really reiterate is that this takes a team. What we have here at LSU Health Sciences Center is a preeminent team of experts that are truly unrivaled, not only in the nation, but in fact in the world. As you just heard from Dr. Scott, we're really in good company with the Karolinska Institute in Stockholm, Sweden, as well as Harvard up in Massachusetts and UAB. So with that, I would encourage you to continue the fight, to continue following all the orders that we've heard from our local leaders, and begin to open this up for questions. I've seen that there are a few questions we've received in advance, and the first one is, how many tests have been completed so far by the EVT lab? So thus far, the EVT lab has done 750 tests. That is quite a big number, and to give you some perspective of these tests, they've come from a wide range of places. Some have come from nursing homes, some have come from other small hospitals in the region, some have come from central Louisiana and as far south as Baton Rouge and a community clinic there. The importance of this testing capability can be borne out by a story that we heard. I'll leave the institution nameless, but that there were many older individuals in this institution that had the disease and they really needed to figure out who had it and who didn't. We were able to turn around this test, this batch of tests, within a 24 to 36 hour period that really allowed this institution to properly separate individuals in that institution so that the virus wouldn't run rampant throughout it. In fact, we're now following up with that institution to do follow-up testing to make sure that no other individuals that were previously negative have now become positive, so we can maintain the integrity of that institution and its efforts. Number two, how close are we to mass testing of asymptomatic people? Right now, we are not testing asymptomatic people. As many of you know, the CDC has a criteria of guidelines, and in fact, there are three priorities: priority 1, priority 2, and priority 3. And those have yet to waver since March 24th. However, as we begin to go down this pathway of opening up serology testing and doing other testing, we anticipate that those criteria will change. And as the country has the capability to do more testing, we also expect that to change. The third question, I think Dr. Scott may be able to talk about, and I think you may have mentioned a little bit, is how many patients were screened and selected for the nitric oxide trial. Dr. Scott, please come.
As I said earlier, the nitric oxide trial, both arms, have a set criteria, and a lot of it has to do just with the duration that they've been on mechanical ventilation. But pretty much we round every morning in the ICU and on the 6th floor to really just evaluate each patient, particularly each new patient, or maybe a patient that had a change in status. And so we're really screening pretty much everybody in that category. We currently have 2 enrolled. We're screening 2 right now. So a lot of it just depends on the number of admissions, but pretty much everyone is being looked at.
Dr. Scott, I have one more question
Yes.
for you. You mentioned reading the live stream. Through these trials, what are some things that you are learning about COVID-19 that might not have been known before, or are we at a place yet where
The question is, what are we learning about this virus and this disease process in the lungs? And we actually had a conference call with the Harvard group this morning, and we're all pretty much baffled because this disease behaves like no other disease we've ever really seen. The pulmonary diseases, they've always been kind of predictable, and this disease is anything but predictable, and all of the things that we thought we knew we're having to relearn. And we're actually learning as we go. And a lot of this, unfortunately, we're not going to really figure out a lot of this till, much later when we can retrospectively look back and see what worked and what didn't.
Another question, are there any side effects for the nitric oxide?
The other beauty, and I'm glad that question was asked, was are there any side effects? And what's nice about this gas, it only lasts about 30 seconds in the lung itself, and it doesn't actually get out of the lung and into the bloodstream. It can have some side effects, just the way it kind of affects the hemoglobin, but we monitor that continuously, and we just down adjust the dose, and that takes care of it. But the beauty of it is it's just really no side effects.
I have a couple more questions to you, or Dr. Pebbles can take this. So far, it's been seen that men who have recovered from COVID-19 donate their plasma, or women who have recovered from coronavirus donate their plasma as well.
Yeah, I'm gonna turf that.
Perfect. Everyone's to take it. So again, I just want to repeat the question, Dr. White. Can women who have recovered donate their plasma as well?
So the question is, can women donate their plasma as well? So we've seen men have been on TV because they've been telling that they've donated, which is wonderful. Yes, women can donate. Initially, we started with gentlemen because it was one test less. They have to do another test at the blood bank to match the blood. But yes, they can test and they can donate, and we're encouraging them to. I've got several people on the list, so let's add your name.
Is it only for people who have had the virus, or can those who have not, or maybe not known that they've had it, can they donate as well?
So there's two questions. One, can I donate if I have not had the virus? And one, can I donate if I thought I had the virus but I wasn't tested? And the answer is the blood bank always needs blood. So if you haven't been, if you have not been ill, absolutely you can donate blood. It won't be used for the same purpose, but it will be used to help people who are ill right now. So donate. And for people who have thought they had the virus, that's what we just talked about, the antibody testing that they've developed here. So we're excited that we can get started on perhaps testing people who have had all the symptoms but were not tested, and so that they can then donate as well.
Thank you so much. Dr. Kevel, this last question might be for you to talk about the manpower. Some testing labs across the country are short on staff. Does your team have enough manpower to meet the local demand?
Right, so that's a good question. The question was, there's been shortages of staff to do these kinds of tests and run these labs, and do we have enough manpower to meet the local demand? And so the answer to that question is, quite fortunately, yes. We're really blessed to have many fantastic scientists and healthcare providers here on our campus that have stepped up. They've heard the call and they have answered. And in fact, we have the fortunate privilege of having a list of people that we can go to and create multiple shifts.
I want to thank all the presenters, the speakers today. I want to thank the media. I do want to remind the folks in the media, and actually everyone in the country, there's a recent article that Dr. Kevel turned me on to, and Dr. Urachko in Science, that just came out in Science. So getting published in Science is probably one of the most prestigious journals that you can get published in. And in this journal, which was titled Projecting the Transmission Dynamics of SARS-CoV-2, that's the COVID-19 virus, through the post-pandemic period, these researchers clearly point out that even in the event of apparent elimination of this virus, surveillance should be maintained, since a resurgence in this contagion or this pathogen could be possible as late as 2024. So this is an ongoing process. That is why the research institutions around the country are so vigilant about creating these processes and of surveillance of antibody testing, because I think even more important than doing the swab testing is going to be the antibody testing, because the swab testing may not tell you whether you're positive or not if you've convalesced from this disease process, but the antibodies should show up, and that's why this testing is very important if we're going to reacclimate folks back into society, both from a work standpoint and from a personal standpoint. So I thank everyone, and God bless you.